Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Understanding chickenpox, a common childhood illness. Chickenpox is a very contagious disease. It mainly affects children. It causes an itchy rash with small, fluid-filled blisters. Most children recover fully from chickenpox. However, it's important to understand the illness and how to manage it. Chickenpox was once very common. Almost all children got it before they were teenagers. Fortunately, we now have a vaccine. This vaccine is very effective at preventing chickenpox. Despite the vaccine, outbreaks can still happen. This is why it's important to recognize the signs and symptoms. Early detection can help prevent the spread of the virus. If you suspect your child has chickenpox, consult a doctor. They can confirm the diagnosis and advise you on proper care. The virus behind the itch. What causes chickenpox? Chickenpox is caused by a virus. This virus is called varicella zoster. It spreads very easily from person to person. The virus travels through the air. It can also spread through contact with the fluid from the blisters. When someone with chickenpox coughs or sneezes, tiny droplets are released. These droplets contain the virus. If a person who hasn't had chickenpox breathes in these droplets, they can become infected. Touching the fluid from chickenpox blisters can also spread the virus. This is why it's important to avoid scratching the blisters, even though they are itchy. Recognizing the signs, symptoms of chickenpox. The most recognizable symptom of chickenpox is the rash. The rash starts as small, red spots. These spots quickly turn into itchy blisters. The blisters usually appear first on the face, chest, and back. They then spread to the rest of the body. New blisters continue to appear for several days. Other symptoms of chickenpox can include fever, headache, tiredness, and loss of appetite. These symptoms usually appear 1 or 2 days before the rash. Section 4. Diagnosis, confirming chickenpox. Doctors can usually diagnose chickenpox by looking at the rash. They will ask about the patient's medical history and symptoms. Sometimes, the doctor may take a sample of the fluid from a blister. This sample is sent to a lab to confirm the presence of the varicella zoster virus. Diagnosing chickenpox early is important. It helps to prevent the spread of the virus. If you suspect your child has chickenpox, keep them home from school or daycare. Contact your doctor for advice. Section 5. Treatment and relief. Managing chickenpox symptoms. There is no cure for chickenpox. However, there are treatments to relieve the symptoms. The main goal of treatment is to reduce itching and prevent infection of the blisters. Cool baths or compresses. Soaking in a cool bath with oatmeal or baking soda can soothe itchy skin. Calamine lotion. This over-the-counter lotion can help to dry out the blisters and relieve itching. Antihistamines. Oral. Antihistamines can reduce itching and help with sleep. Acetaminophen. This over-the-counter pain reliever can lower fever and reduce discomfort. It's important to avoid scratching the blisters. Scratching can lead to infection and scarring. Keep fingernails short and clean to prevent infection. Section 6. Prevention is key, protecting yourself and others. The best way to prevent chickenpox is through vaccination. The chickenpox vaccine is very safe and effective. Children should receive 2 doses of the vaccine. The first dose is given between 12 and 15 months of age. The second dose is given between 4 and 6 years of age. Vaccination not only protects individuals from chickenpox, but also helps to prevent outbreaks. This is especially important for people who are at risk of serious complications from chickenpox, such as pregnant women and people with weakened immune systems. UMCC, your ultimate medical consultants connectors.